Are you one of those people whose blood pressure only seems to measure high when you go to the doctor? Well, our 9 Health expert, Dr. Payal Kohli, is here. Of course, you are a cardiologist. You deal with this all the time. So there's a condition you guys have a fun term for, white coat syndrome. It's not as benign as it sounds.
It really isn't. We used to think it's benign because you only get high blood pressure when you go to the doctor. You see their white coat. Yeah, it causes the stress about what they're going to tell you. But we're actually learning that 15 to 30% of all cases of high blood pressure have white coat hypertension, and it's actually a harbinger that you're probably going to go on to develop high blood pressure, and it's not something you ought to ignore.
Because it shows that you have that capability to carry that high blood pressure under any kind of stress.
Yes, in fact, what it shows is that your blood vessels are not normally responding to stress. So the elastance, or how much your blood vessel stretches, is abnormal. And that means, Tom, that every time somebody cuts you off on the road or you're running late for something, that blood pressure shoots up.
So what about when your blood pressure is normal when it's being measured, but it potentially is high at other times? How does that work? Because you said that there is a flip side to this.
There is, and that's called masked hypertension. Okay. And in some ways, that's even trickier because when you're at the doctor, it measures normal. But in other certain settings, when you're doing something physical or other settings, it can actually be high. That one is harder to detect and diagnose, and that's why people need to have their guard up for both types of high blood pressure.
So if it isn't stress that's raising your blood pressure, what are those triggers? What are the things that are pushing that blood pressure to dangerous levels?
Well, so essentially, the stress kind of brings out the underlying problem, which is an abnormal elasticity of the blood vessels. So now this happens more in women, believe it or not, and it also happens more as you get older because our blood vessels have a tendency to get stiffer as we age. That's how our blood vessels age. So they don't respond quite as well to the extra stress that's added from the stress hormones, and that blood pressure can shoot up very suddenly. But the message here, Tom, is it doesn't matter why your blood pressure is shooting up. If it's shooting up, it is a sign that it needs to be treated.
Do you find that psychologically patients are told that they have a blockage in their heart or there's a problem with their heart? They react, this is important, this is urgent. But if you have high blood pressure, they go, okay, high blood pressure. It's not a big deal.
All the time. And there's a reason it's called the silent killer, because it's just silently doing all kinds of damage inside you. All of your organs are getting affected, whether it's your kidneys, your brain, your eyesight, your lungs, and you don't even realize it. And unless you go looking for it, you may not even know that you have high blood pressure.
So how can the holidays be an effect on what people are doing if they have this white coat syndrome?
Yeah, you know, the holidays are a great time. We're so happy we get to see our family, but the opposite is also true. We're a little more stressed out. We might be drinking more alcohol than usual. We're eating more at holiday parties, having more sodium. Our sleep patterns are a little bit different. We're traveling. So all of those factors can really contribute to specifically increase the risk pretty much for everybody, but even more so for those that have white coat hypertension.
So get your blood pressure checked and take care of it. It's as important as anything else you can do.
That's right. It's like brushing your teeth. And I tell my patients sometimes just check it a few times a week, even if you're healthy, just so you can stay ahead of that silent killer.
All right. Thanks. Dr. Payal Kohli.